Sebaceous cysts are oftentimes confused with things like pimples. So the key here is to not squeeze the area. As we discussed in a different video, sebaceous cysts are just like grapes, very thin wall on the outside with the content on the inside. The key is that you don't want to disrupt that outer shell or that outer wall of the capsule. Again, you don't want to do this because you want to make sure that at the time of its excision or removal, the entirety of the wall is removed intact or in one piece. Because if you don't, you're going to have a higher risk of recurrence or that cyst coming back again. When examining yourself to see whether or not you have a cyst, you want to make sure that you're gingerly pressing the skin around the area where that cyst could be, and you want to make sure that the area itself is nice and mobile. It feels like a marble underneath a sheet, the same way that you can have the marble move. And a fixed area is how that cyst is going to feel underneath the skin. Now, you can have areas where you have an active infection or a chronic infection. An active infection of a cyst is a little bit more cumbersome. The reason behind it is because you're going to have more erythema or redness overlying the cyst itself. You could have drainage from the cyst itself out from the skin, the same way that a pimple would. The contents coming outside of the skin are going to be more of a cottage cheesy-like material, and they tend to be malodorous. Those are the patients that I'll oftentimes place on an interim of antibiotics to allow that area to cool off, and then give it enough time that the capsule itself will redevelop itself and become back into that marble or that grape-like substance. Again, it makes the extraction or removal far easier. Should this be a chronic issue where you've had this cyst for months to years, and you've had previous episodes of acute infections, but it's no longer acutely infected, we can still remove that through an excision. The key here, again, is please don't squeeze these cysts, because the more you traumatize that external shell, and the more likelihood you have of the contents within that shell go to the outside areas, are going to make that extraction far more difficult and increase your chances of getting an acute infection. I hope that clarifies cysts for you. Thank you very much.